by my watch, it's 7 o'clock. And so we could get started. I see no questions yet. If anybody has questions, please do type them in the chat area, or email. You can even email live now. I'm still getting my email on behind the screen, so I can still look at it. I'm at kreed@carlislemass.gov. So if you want to email questions, that's fine. Chief, would you like to start us off with the LEPC update?
We have not a lot of significant updates. We've stayed on WebEOC. From a department standpoint, we're getting a dispatcher back that tested negative. So now we only have one police officer out, still waiting for the test back. We've had a decent amount of resources dropped off the police department. Today, several different people brought in masks. So we're getting at a good spot with masks. Our order of Clorox wipes came in, which is very helpful. We're holding pretty steady on gloves. And Rob from the school came over with their device that sanitizes surfaces and kills the virus. Fortunately, he bought one of those before the price went through the roof, and they're not available until September. He brought it over, disinfected the police department today and all our cars. And I think he hit the fire department in the afternoon.
10 minutes.
So we're at I think we're at a decent spot. I've gotten emails on both sides after the keto article. There's people who, I got one that was not in favor of us keeping the parks open, and then some others that were. So just as a status, we can talk about it tomorrow morning at LEPC, but there was that. I got it today. Other than that, I don't have anything that's changed significantly since our LEPC meeting yesterday or the Selectmen's meeting Tuesday night. But I also have my email open, so I just checked in case any questions came up while we're on. If anybody wants to email me, I'll take a look at those also. So thanks, Kate.
Okay. I see a number of other people have now been joining in over time. We have about 26 people. I will repeat my message. Some of you are apparently on phone and are not able to use the chat function on the Zoom. So if you wish, you may either email the chief or myself, kreed@carlislema.gov, with any questions you have, and we will certainly try to get to them. If not tonight, first thing on Tuesday when we have our Tuesday meeting. We will Tuesday have about an hour again for open questions, and then we will have some agenda items that the board will be discussing. All right. Chief Sarles, would you like to add something about what's going on at the fire department?
Yeah, so we've done okay with supplies as well. The schools are very helpful. I said that last Tuesday. They brought a bunch of things down. A number of them were things that would be otherwise very hard to obtain, so that was great. We did have the fire station sanitized again today. The ambulance is sanitized. That's been great. Regionally, there's been a lot of discussion because one of the biggest concerns regionally is the nursing homes, and there have been some issues with those. You know, obviously we don't have that. We have some group homes, but you know, we may be called in to help out if they need to evacuate or move a lot of patients at once in those situations. And regionally, we're also, our district has worked up a continuing operations plan in terms of if large numbers of staffs of a number of fire departments end up going out. But so we're trying to prepare, and again, like I said before, it's kind of the calm before the storm. It's a little bit eerie. I will mention that if folks do have the need to go to the hospital, it's probably not a good idea to wait until it's, so if you don't need to go, you don't need to go, and that's the right thing right now. If you do need to go, to wait until you have to go to intensive care, don't wait until the appendix is burst before you go, because that doesn't help anybody either. So if you do need to go, make sure you go. If what you need is not urgent, then you may not want to be, do telemedicine, talk to somebody, make sure it's something that you need to be into the hospital for. That's largely my status.
Thank you. Let me see. Angela, do you want to talk a little bit about our neighbors program or anything else you'd like to talk about with us about the COA?
Sure. Lori Eckler has put together a group of volunteers, many of whom had come to us at the very beginning and offered to help. And announcements are going out today. I know it's been sent over to Benfield, and we'll send it around to everybody else tonight. And tomorrow it will go out in News You Can Use, that they are there to help people that do not have family and friends, to help with grocery shopping and pharmacy items and dog walking. And they're willing to help get food from CCHF if they want that. So we're thrilled that they are there, and we hope people that shouldn't be out and about take advantage of their resources.
Great. I don't see any questions yet. We're going to go ahead. Maybe Jim, would you like to talk about schools and how you guys are getting along there? And
sure, I can give it a shot. There may be some background noise. Things remain fairly consistent out at the schools. We're segueing into phase 2 for instructional purposes. Up till today, or tomorrow actually, we looked at more enrichment, engagement, looking out for the social emotional needs of our students and families. And we're going to be moving into phase 2 next week, where we're going to try to make some progress with regard to our curriculum. But there are a lot of challenges we'll be facing with regard to that. We've also had some, with regard to the bigger picture, Amy Smack has helped to lead kind of the gathering of whether it's goggles in the school or disinfectant wipes and whatever materials we have to make them more available to our first responders and our healthcare professionals. We have Ginny Lemire from our engineering room has been printing up the shields that those can be used and sharing those out. So we're really just trying to take whatever resources we have and make them available in the best way possible to the community.
Thank you. We have a message from somebody that their audio has dropped off, but I heard everything Jim said. Did anybody else having trouble with the audio? Does anybody have some suggestions for the person who seems to have, Chief, you seem to be
Every
muted.
once in a while that the speaker will kick off. I'm not sure whether somebody jumps on and changes the configuration, but I'm sending her a quick text on that. She may have to check make sure her speakers didn't get shut off without her touching it.
Yeah, it might make sense for her to just leave the meeting and then come back into the meeting.
Right.
Yeah.
And if it's breaking up on you because of bandwidth, if you shut off the video when you're not using it, that also helps.
Okay.
Angela, I wonder if it makes sense for you to provide the way for someone to reach the Good Neighbor team, or where on the website they could find that.
I'm not sure Angela
Oh.
heard you.
Angela,
Angela, you're muted if you're talking, because I can't see you now.
Sorry.
Angela,
I can give them a phone number to start. It's 978-254-0508.
can you say that one more time, please?
978-254-0508, and that's the Carlisle Neighborhood Response Team.
Because people that are listening, if you know of somebody that might benefit from this, it would be great to encourage them to call. I know we're all kind of stiff upper lip New Englanders, right? That, but we, this is a great way to just make the life of somebody who's maybe struggling a little bit or isolated, to help them out. So please spread the word.
Okay, moving around the table of the LEPC, I'm going to go to Alan. Would you like to add anything from the LEPC that?
No, I think it's all been covered pretty well. We're moving very deliberately. Things are still in progress that need to be put together, but that's being taken care of too. So I think everything's going along pretty well at the moment. We're got to prepare for the surge in the next couple of weeks. That's all.
Okay, and Linda, I'm saving the best for last. George, whoever George is, could you not screen share, please? Because it's killing everybody's screens. It's killing my screen. So whoever George is, please take your screen share off.
Tim, I think you can prevent that from happening.
Okay, Linda, why don't you go ahead and report? Maybe Tim will work on this screen sharing business while you're reporting.
Tim, if you go into the screen share settings, you can just go to advanced settings and say that you're the only one that can share the screen, and that will stop it.
Thank you. Okay, thanks for your patience. Linda, we will get through this. We will all learn. This will be okay. I know there's been before you start, Linda, I just want to say also, I know there's been a lot of negative press about Zoom, but I think it's still the best show out there for now. So we're taking our chances with it, and we'll keep everybody informed if for some reason we feel that we, for security reasons or whatever, we can't continue with it. But
we will know the crisis is over when we all know how to do it exactly.
Exactly, right.
The last person. It's called ragged edgemanship.
Yes, there you go. All right, Linda, sorry for the interruption.
Okay, so yes, these 2 weeks have been very interesting, and I see it as we're still in the initial planning and response stage, but during that time I'm really seeing a lot of good things. The neighborhood network system coming up, people are following the social distancing, and cases in Carlisle. So today we had 5 confirmed cases and 7 contact.
Did you say 5?
5.
5, thank you.
Yesterday it was 5 confirmed and 6 contact. So these numbers are changing daily, and we are trying to post them on the town website. One of the things people should know, if they are identified as a close contact, initially Department of Public Health wanted us to do daily check-ins with them, and then they realized this would be just really out of a possibility. So there'll be an initial notification, there'll be provided guidance, and then at the end of the 14 days, if they're asymptomatic, they will be cleared. And so of those 5 confirmed cases that I just mentioned, 4 have already dropped off the list. In other words, they've gone through, or rather of the confirmed, they've totally gone through the isolation, and they're no longer considered infected. So that's why the numbers are always changing, and it's can be a little hard to track. Other than that, we do appreciate that people are really paying attention to the social distancing. If anyone has health questions or specific questions about their household, you're welcome to leave a message at the Board of Health office or email me. And if it's a medical question, most likely I will put you in touch with our public health nurse. So I think that now Todd Thorsen, I think, may be on the line. Chairman of the Board of Health, he might have something additional.
Todd?
No, I don't have anything else.
Nothing else.
Nope.
Linda, I have a quick question, if I may. I had somebody stop me and ask me the other day if their immediate neighbor was tested positive. Are they notified or not?
No. So if you come down with COVID, what the nurse or whoever the health person is who contacts you, they will develop what's called a close contact list. And it really is someone that you've been physically close to within a 6-foot space and for a fair amount of time. So just being a neighbor would not put you on that list. And we are not allowed to identify households, because of confidentiality, personal health. But you would not have to worry. If they are considered a close contact, they will be notified and followed up.
Okay, thanks.
There are a fair number of people who haven't been tested, who have it, and this, so those wouldn't be on the list. The best thing to do is assume your neighbor has it and then act accordingly. There are also people who are not symptomatic who are carrying it. So it's best just to treat, and there's no exposure from being next door, unless you're sharing airspace.
Okay, thanks. Thank you very much.
Don't put things in their mailbox. Yes.
Well, that's actually this person's concern was he's pretty active in the neighborhood and trying to help out people. And, he was worried about kind of going door to door if there might be somebody there that he didn't know had tested positive.
Yeah, well, I think the rule of thumb is assume everybody has got it and act, just be super careful, wear gloves and a mask, or keep 6 feet away, and, don't use the doorknobs because that's what's going to get you.
Yeah, I'll pass that.
Anybody who want to raise their hand? There's no questions on the chat. I have not gotten any other questions. Is there anybody else who would like to report that I've missed?
Kate, I've seen Laurie Eckler's on. I don't know if she wants to say anything or not.
Laurie? There you are. I see you now. Yeah, Laurie, you're muted.
I unmuted myself. No?
Okay, now you are. Now you're unmuted. Okay.
Okay. So the update from the neighbor response, the Carlisle neighbor response team, is that we today printed posters, our Call Your Neighbor posters, which will be, as soon as it stops raining out, will show up on sandwich boards around town. Amy Smack went and printed a bunch of posters today. They look great. And they're tied into the Call Your Neighbor campaign, which is to encourage anyone, a senior citizen or anyone at risk, to reach out to the Carlisle Neighbor Response Team and get support in terms of, first and foremost, trying to get them set up with online deliveries of groceries and pet supplies and prescriptions and non-prescriptions. And then, we've talked about people that might need dog walkers. And then the Carlisle Phone Pals is linked to that too for emotional and social support of people who are isolated. So Angela sent, I don't know if she's on the call, but she sent out to Benfield and to Village Court and to Malcolm Meadows today some press release / flyers that said, let us help you. And then we also generated a Call Your Neighbor flyer, which we're circulating as well. We'll post it on Facebook. We'll give it to the Mosquito and share that out. So we'll have neighbors calling neighbors to check in and encouraging people to seek support if they need it. And that's about it.
Great. Is there anybody else? Any questions?
Hey, may I throw one more thing in?
Sure.
So I hope that folks that are watching or listening get the idea. If it seems like, we've worked up and set up an infrastructure that it's scalable and can take a great deal of traffic, I hope that's the impression everybody's getting. and that the members of this committee are committed to keeping Carlisle as ahead of the curve as we can be. It's going to seem like we're ahead of the curve right now because we know the worst is yet to come. But that I hope that folks are getting the idea that we're paying attention, and it's not a problem at all to watch and not ask a question, and it's also not a problem at all to throw suggestions or questions out there. That we look forward to those, and that we're committed to making this as good as it can be.
Yeah, and some good news. I was at the post office today mailing off a package of masks that my wife has sewn, and there were 2 other people in there at the same time doing exactly the same thing. So thank you to the people of Carlisle who are really contributing to this.
Yeah. And Kate, I just want to add that I would love if people who might anticipate needing support reach out soon for support so we can get them set up. So if we do get an onslaught of requests, we have some people that are already set up and ready to go.
Right.
And that would be very helpful.
Absolutely. Don't wait until you're desperate.
The price is right.
Yeah. Ask us now. Even ask us a little for the future. If you say,
right.
You can even call and say, I don't need you today, but I'm anticipating maybe in a week, or whatever, put me on your list. Let us know, so that, because if it turns out more people need help than we anticipated, now is when we need to know so that we can scale up. We are trying to think of as many scenarios as we can think, but kind of working in the dark in certain respects. So the more information people can give us, the earlier, the better it is, and more ideas as well, as what Chief Fisher was saying. If you have an idea, let us know. we'll work on it. We can't always do everything. Yeah.
I have a quick question.
Yes.
Have we had any Carlileans that were reaching out because they are symptomatic, they're living by themselves, and they need check-ins just to make sure that there's someone in contact in case their symptoms get worse?
Bryan, do you want to? You still there?
Yeah, I'm here. So we do know of people. Most of them have a support structure at this point. That they're people contacting them. The Council on Aging has more of the lists that they're going through. Although most of their list is not symptomatic at this point. We will, if there's a need to provide services where we need to be exposed, the fire department is the one who will, has the PPE to be able to do that. We will do that. Does that answer?
Kate, if I could just add, if you, we first started out trying to do the phone pals to encourage people who live alone to get connected, and then Lori and her team have added the further services for shopping and pets and all of that. But I think what we're running into is people don't realize that they're building an infrastructure for themselves if they make this connection now. So if you have an older neighbor or someone who lives alone, it would be awesome if we could each call that neighbor and say, you should hook up with this because that's going to give you the resources you need if things get ugly. But I think that we need to actually make the calls to these people, because I think, John, you said earlier, Chief, you said earlier, these just tough Yankee birds, they just don't want to reach out for help. So it'd be good if we could help them get the help before they need it. That's it.
Yeah, that's another good pitch.
Thank you, Jean-Luc Picard.
Yeah. All right. I'm bringing my TARDIS next time. Hey. So, okay. Well, it is 7:25. I don't see any questions from the audience. We will be back at the same time on Tuesday for similar briefing. And then after that, we will have our regular, more of a regular selectmen meeting because we have some things that we are going to have to address again because of the COVID. So that I think our format will be a little different going forward, but we did want to make ample opportunity for people to get their questions answered. Again, I want to encourage anybody who has a question between now and then, please email us. It's kreed@carlislemass.gov, or Tim or any of the other selectmen. If you feel more comfortable, let us know what your questions, comments, concerns are. We will certainly address them at the beginning of our meeting. And you'll also have a chance to, add your questions on the chat. And I wish everybody a good night and stay safe and well and wash your hands.